So when we think of community education, the first thing we probably need to do is define it. What is community education? This really isn't a term that a lot of other industries use. It's similar to marketing or business development, terms that we're just a little bit more familiar with. But at the heart of community education is really just spreading the awareness to the community about your program. And for healthcare specifically, you need to be targeting the doctors in your community that see the types of patients that you need in your outpatient wound care and hyperbaric department for your facility to grow. So it kind of goes without saying that patients are the reason why any service line exists. And there are really two primary sources that drive business to your program: self-referrals and provider referrals. Now, we might look at self-referrals and think, okay, well, why do I need to have a relationship with providers to get those referrals? But what we found in healthcare is the phenomenon that even if your insurance company doesn't require a physician referral, you still want to start with a recommendation from a doctor you trust, which is why in outpatient wound care, referring providers are really the foundation of your growth and business development initiatives. So we're going to think about it in terms of referring provider relationships, because you've got to build professional relationships with your community providers.